Dear students, today we shall see about cysts of oral region. So, what is a cyst? A cyst can be defined as a cavity. So, what sort of a cavity? It is an epithelium-lined pathological cavity filled with either a fluid or semi-fluid material. And cysts of the maxilla, mandible and perioral regions vary markedly in their histogenesis, incidence, behavior and treatment. Kramer in 1974 defined cyst as a pathological cavity filled with fluid, semi-fluid or gaseous content and which is not created by the accumulation of pus. Most of the cysts are lined by an epithelium but not all cysts. So cysts of the oral region can be divided into odontogenic cyst, non-odontogenic cyst and pseudocyst. Pseudocysts differ from true cysts because they do not have an epithelial lining. If you take a true cyst, a cyst will contain a cavity called as a lumen. That lumen is surrounded by an epithelial lining. The epithelial lining is in turn surrounded by a connective tissue wall. So, cysts of the oral and maxillofacial region can be classified as cysts of jaws, cysts associated with maxillary antrum, cysts of soft tissues of mouth, face, neck and salivary gland. So, if you see cysts of the jaws, again cyst of the jaw can be epithelium lined cyst, non-epithelial cyst. Epithelium lined cyst can again either be odontogenic or non-odontogenic. An odontogenic cyst can again be developmental or inflammatory. And non-odontogenic nasopalatine duct cyst, globulomaxillary cyst, nasolabial cyst, then median palatine cyst, all these are non-odontogenic cysts which are not associated with tooth-forming apparatus. Non-epithelial cyst is your pseudocyst like simple bone cyst, traumatic bone cyst, aneurysmal bone cyst, all these things. And if you see odontogenic cysts are epithelium-lined cyst. They are true cyst. They are associated with tooth-forming apparatus. And they are divided into developmental and inflammatory. So, developmental means it can be dentigerous cyst, OKC, lateral periodontal cyst, eruption cyst and everything. Inflammatory, the most common is periapical cyst or radicular cyst. And cyst associated with maxillary antrum, like benign mucosal cyst of maxillary antrum or surgical ciliated cyst of maxilla. And cysts of soft tissues of mouth, face and neck, we have epidermoid cyst, dermoid cyst, cystic hygroma, thyroglossal duct cyst and everything. So, as I said, epithelium lined cyst, again odontogenic, non-odontogenic and everything. And yes, there is one more classification for these odontogenic cysts, like it can also be classified according to the cell of origin. For example, if it is from the epithelial cell rest of Malassez, then the classic example is our periapical cyst or the radicular cyst. Or if it is from the reduced enamel epithelium, it is dentigerous cyst. So then there are some cysts that are derived from the dental lamina. Most of the odontogenic cysts are derived from the cell rest of the dental lamina or the cell rest of Serrae, like the OKC, the lateral periodontal cyst, gingival cyst of newborn, gingival cyst of adult, then calcifying odontogenic cyst, glandular odontogenic cyst. So what is an odontogenic cyst? As I said previously, it is a cyst which is associated with tooth-forming apparatus or some cyst which is derived from an epithelium involved in tooth development. So it could be dental lamina or reduced enamel epithelium or cell rest of Malassez or anything. So how does a cyst develop? Yeah, the cyst develops into like a cyst formation has two major phases. One is initiation and enlargement. That is, initiation means there will be proliferation of epithelial lining and a small cavity will be formed. This cavity will enlarge, which is called a cyst enlargement. So first, we shall see about all the developmental cysts. The most common developmental cyst is dentigerous cyst. Dentigerous cyst is also called as a follicular cyst. It is an odontogenic cyst. It is a developmental odontogenic cyst that surrounds the crown of an impacted tooth and it is caused by fluid accumulation between the reduced enamel epithelium and the enamel surface, resulting in a cyst in which the crown is located within the lumen. So the most common cyst that is associated with an unerupted tooth is dentigerous cyst. The most common unerupted tooth that is involved are permanent mandibular third molars, because as we all know, permanent mandibular third molars are the most common tooth that are involved in Impaction, yes. And it's slightly more common in males than females. And next to the mandibular third molar, maxillary canines are involved. And clinically, it presents with the swelling and pain. Usually, there is no pain or discomfort. Sometimes sometimes it can be associated with pain if it is secondarily infected. There are a few syndromes like cleidocranial dysplasia and Maroto-Lamy syndrome where multiple and bilateral dentigerous cysts are seen. And radiographically, it can be seen as a unilocular radiolucency. What we need to know about dentigerous cyst radiographic features is there are three variants: central, lateral, and circumferential. That's it. So central means the cyst will be surrounding the center of the crown, and circumferential, it will surround the whole of the tooth, mostly involving the root also. And lateral is the lateral aspect of the tooth will be involved. And yes, as I said earlier, it arises from the reduced enamel epithelium. And histologically, the cyst contains a non-keratinized epithelium. The epithelium will be only about 2 to 4 cell layers containing flat cuboidal cells. Sometimes there can be mucous cells and ciliated cells seen. So this picture shows a fibrous connective tissue wall with a very thin epithelium. And there is one thing called as an eruption cyst. That is, this is a dentigerous cyst only, but this will appear after the tooth has erupted or it has pierced the gingiva. It has come out from the bone. So, an odontogenic cyst with the histological feature of a dentigerous cyst that surrounds a tooth crown that has erupted through the bone, but it has not erupted through the soft tissue. That is called eruption cyst. Sometimes blood will blood gets filled into the cavity, and in such case it is called as an eruption hematoma. Another most common developmental odontogenic cyst is called as odontogenic keratocyst or keratocystic odontogenic tumor. It's a developmental odontogenic cyst derived from the remnants of the dental lamina. It has a biological behavior very similar to that of a tumor or a benign neoplasm. And it is a cyst which has the potential to behave aggressively. Recurrence rate is more. It is more commonly associated with syndromes. And it's more common in male than in female. And mostly the posterior portion of the mandible is affected. And mostly it presents with the pain and swelling. There is one syndrome which is very commonly associated with OKC is Gorlin-Goth syndrome, also called as bifid rib syndrome or nevoid basal cell carcinoma syndrome. And radiographically, mostly it will appear as a multilocular radiolucency, sometimes also as an unilocular radiolucency. And yeah, recurrence is very common with this cyst, and it arises from the dental lamina. That is the remnants of the dental lamina or extension of basal cells from the overlying epithelium. So as you can see, there is a very thick epithelium. The epithelium will be about 7 to 8 cell layers thick. It is keratinized, stratified squamous epithelium. Parakeratin will be seen, and corrugations will be seen on top. Corrugated parakeratin. Basal cell layers will be palisaded, resembling a tombstone appearance, and there will be hypochromatic nuclei and with a fibrous connective tissue wall. And so the treatment will mostly be enucleation, but recurrence rate is more in case of OKZ. Another developmental odontogenic cyst is lateral periodontal cyst. It is a slow-growing, non-expansile developmental odontogenic cyst. It is derived from one or more rest of the dental lamina, but it contains an embryonic lining of 1 or 3 cuboidal cells, and distinctive focal epithelial thickenings called plaques are usually seen. So you can see the location of a lateral periodontal cyst between the roots of 2 teeth. And there are some possibilities which explain the origin and mode of development. Like initially they will originate as a dentigerous cyst along the lateral surface of the crown. And as the tooth erupts, the cyst will assume a position and approximation to the lateral surface of the tooth. Or sometimes proliferation from the cell rest of Malleus in the periodontal ligament, or sometimes proliferation from the cell rest of dental lamina, which are in a post-functional state, and therefore they have only a limited growth potential. That is in accordance with usually the small size of the cyst. So these are the possible pathogenesis of a lateral periodontal cyst. And histologically, it will have a stratified squamous epithelium with 1 to 5 cell layers thick, but the most striking diagnostic feature is the focal thickened epithelial plaques that are seen in the lining and cyst wall will be seen. So here we are able to clearly differentiate those epithelial thickenings or the epithelial plaques. And the Botryoid odontogenic cyst is the extra osseous counterpart of lateral periodontal cyst, and it is more aggressive than lateral periodontal cyst. Gingival cyst of adult, yes, it is also developmental odontogenic cyst of the gingival soft tissue. And this is derived from the cell rest of the dental lamina containing a lining of embryonic epithelium of cuboidal cells and focal thickening similar to the lateral periodontal cyst. On gingival cyst of newborn, there are two variants. One is Bonn's nodules and Epstein's pearls. Bonn's nodules are keratin-filled cysts which are scattered all over the palate, mainly at the junction of the hard palate and soft palate. Epstein's pearls are also keratin-filled cysts, but they are seen along the mid-palatine raphe. So, these are gingival cyst in an infant. Glandular odontogenic cyst is also called a xyloodontogenic cyst. It is derived from the cell rest of the dental lamina. It is named so because the cyst has stratified squamous epithelium containing numerous mucus secreting cells, and this cyst is very common in the anterior portion of the mandible, and this is also highly aggressive in nature. And so you can see the epithelium with so many mucus cells, a stratified squamous epithelium with so many mucus cells. And the calcifying odontogenic cyst, it's also called as calcifying cystic odontogenic tumor. It is a cystic lesion in which the epithelial lining shows a well-defined basal layer of columnar cells, and mostly the lining epithelium shows masses of ghost cells that are seen, which it can be seen both in the epithelial lining and also in the fibrous capsule. And this ghost cells is one pathognomonic feature of this calcifying odontogenic cyst. And the ghost cells, they can usually be seen in groups in the epithelial lining. And yeah, so you can see one epithelial lining with so many ghost cells. Cystic wall, yes, of course, it is made up of collagen fibers. And inflammatory cyst, the most common example, as we all know, it is radicular cyst, also called as periapical cyst. Mostly arises, it is associated with the caries tooth, very common in the 3rd, 4th and 5th decade of life, associated with the caries non-vital tooth. Pain and swelling will be there, unilocular radiolucency will be seen. So this is a picture depicting a non-vital tooth associated with the radicular cyst. And radicular cyst will arise as there will be 3 phases. One is phase of initiation, then cyst formation and enlargement. So what will actually happen is trauma to the tooth, like periodontal disease or dental caries or trauma of any form. It will affect the dental pulp. So there will be necrosis of the pulp. Then this will extend to the apical bone inflammation. This will in turn stimulate the epithelial cell rest of Malleus. The epithelial cell rest of Malleus will proliferate. Excessive proliferation will cause necrosis in the center of the mass. So there will be a cavity filled with fluid surrounded by an epithelial lining. So histologically, there will be a non-keratinized epithelium, and one striking feature is the presence of Rushton bodies. They are hyaline bodies which appear as irregular eosinophilic glassy structures, often with the granular center within the epithelial lining and less frequently the connective tissue wall of a proportion of odontogenic cyst. So these are hairpin bend-like structures, curvilinear structures, the Rushton bodies. So much of inflammation will be seen in the connective tissue. Residual cysts, sometimes radicular cysts will be retained even after the extraction of teeth. That is called residual cyst. Then there is something called as paradental cyst. That is, it is a cyst of inflammatory origin that occurs on the lateral aspect of the root of partially erupted mandibular third molar. So that is called as paradental cyst. So with this we have covered all the cysts of the oral region, including the odontogenic cyst, the developmental odontogenic cyst and the inflammatory odontogenic cyst in detail.